to skin just means, they're going to lay the baby on the parent's chest. That has been shown to be beneficial in early bonding as well as promoting good breastfeeding right off the bat. So that usually gets done pretty quickly, and often if you are planning to breastfeed, there's even going to be a lactation consultant there nearby to help with that initial feeding, help get the baby latched on as well.
Listeners, welcome to the brand new season 7 of Doc Talk Live. Doc Talk Live is a health show dedicated to educating listeners on different health topics every week. We do so by bringing in experts to answer your questions. To find out more information about our show, you can log into our website, doctalklive.com, or you can also log into our social media platforms, YouTube, Facebook, Instagram, and Twitter. We are happy to have a very interesting topic lined up for you all today, and my name is Dr. Sri Venkatraman. I'm going to be the host today, and today we are going to be talking about newborn survival guide, and we have an expert with us in the studio, Dr. Manring, who is going to be talking to us to see what we need to know and what are the different things that we are expected to know as a new parent. Dr. Manring, welcome to Doc Talk Live. Thanks for volunteering your time to be with us. Would you please introduce yourself to our listeners?
Absolutely. Well, thank you so much for having me. I'm so excited to be here on the show today. My name is Dr. Isha Mannering. I'm a board certified pediatrician. So that means I specialize in taking care of children of all ages, from the newborn stage all the way through the transition to young adulthood. My practice is Forest Link Pediatrics, and I've been practicing there for about 8 years now. I'm primarily in our Frisco location, but we have office locations in Dallas and Mesquite as well. And we are on staff at 7 hospitals in the DFW Metroplex. We have 15 board certified pediatricians in our group, and we have 2 certified lactation consultants. So I absolutely love my field. It's my passion. I can't imagine anything more fulfilling than what I do. And one of my favorite parts of my specialty is just the long-term connection that I get to establish with my families. So I often will meet new parents before they even have their first baby, and then I get to follow along with them through different stages of their child's life and, kind of see them through till they go off to college. So I think it's a very unique and amazing specialty, and I feel so lucky to be able to do what I do. I wanted to do this particular episode because one of the most common things that I get asked about is, how do you get through those first few weeks with your new baby?
Oh, yes, absolutely. The thought of having a baby, the first time parenting is exciting, but then the fear that comes along, what do I do? When do I call my doctor? Do I get worried? So we are very happy that you have volunteered your time to talk with us about the newborn survival guide. That's a great topic. Thank you, Dr. Manring.
Thank you. Well, I appreciate the opportunity to discuss one of my favorite topics, babies. So,
awesome,
yes.
Awesome. So let's get started, Dr. Manring. So for the first time parents, when the mom is getting admitted to the hospital, what is she going to expect, like after the baby is born? Do the pediatricians come to see the baby, or what are the things that a mom and a dad should know?
Absolutely. That's a great place to start. And, what I tell my families is you will be in good hands because there will be a team of nurses there and doctors to help mom, help baby, make sure, everything is being done as safely as possible. Every hospital is a little bit different, but most hospitals have a separate labor and delivery area, and that's where you will be admitted initially. When you are in the delivery room where you're going to have the baby, there are going to be nurses helping mom. There's going to be mom's doctor, her OB, who's helping make sure mom is safe and making sure that everything's being monitored appropriately. And then in that delivery room, you may also have some nurses there that are going to be there to help with the baby. So after the baby is is delivered, there may be a nurse just checking on the baby, making sure the initial vital signs look good. They're going to weigh and measure the baby right there in the room. So a lot of parents are eagerly waiting for that weight and that length measurement so they can announce it to their families and friends. So all of that will happen, pretty quickly right away. And then after baby is delivered, they're going to try pretty quickly to get baby skin to skin on mom or one of the parents. So skin to skin just means, they're going to lay the baby on the parent's chest. That has been shown to be beneficial in early bonding as well as promoting good breastfeeding right off the bat. So that usually gets done pretty quickly, and often if you are planning to breastfeed, there's even going to be a lactation consultant there nearby to help with that initial feeding, help get the baby latched on as well. And there are a few other things that they may do, pretty early on with the baby. One of those is just administering vitamin K injection to the baby.
Okay.
And the reason that's important is babies' livers are still immature. And in our livers, that's where we produce a lot of the clotting factors that we need to make sure our blood clots properly. And so the baby may need a little boost of vitamin K to help form those clotting factors. So that gets done pretty early on to make sure we avoid any bleeding issues. And then the baby may also get some eye ointment, which can help prevent certain eye infections that can be harmful in the first few months of life. So all of that happens pretty quickly. And then, you maybe spend a couple more hours in that delivery room or recovery room, and then you may be moved into a different room in the hospital where you'll kind of settle in for the rest of the hospital stay. And you may have a new team of nurses taking care of you. There's going to be, a nurse helping with mom's pain medications, her postpartum care, and then there's also going to be, help with breastfeeding and doing any screening tests that are recommended for the baby. Now, most hospitals now encourage rooming in, which means that the baby is going to spend most of the time in the room with parents.
Oh,
so
that's nice.
Yeah,
that's
the
nice.
days of the nurseries
It's all gone. So
yes,
the baby's going to be with the mom.
exactly, which is great. It helps promote bonding, and it also helps it helps promote good feeding habits right off the bat.
Gotcha.
Yeah.
So do I get to see the pediatrician? Do they come and visit the baby and the mom so you get to talk to them? Do they do that in the hospital?
Absolutely, yes.
Okay.
So if your chosen pediatrician is on staff at the hospital where you deliver,
Okay.
they'll actually be notified by the nurses from the labor and delivery area. Now, you're going to be too busy to worry about calling your pediatrician,
That's
so
right.
the
Okay.
nurses will help kind of take care of that for you. And if you don't have a pediatrician picked out, or if your pediatrician is not on staff at that hospital, no problem. There's going to be a pediatric provider that will be assigned to the baby, and they will come see the baby within the first 24 hours. We usually like to do a good thorough exam, kind of check everything head to toe, make sure everything looks healthy, and then every day that you're in the hospital, your pediatrician or pediatric provider will come in and check on the baby, make sure everything continues to look healthy, discuss feedings, and assess for any issues that come up in those first few days.
Gotcha. Dr. Manning, so technically how many days the mom and the baby spends? It's actually a day or two and they're ready to go home. They send you out, or do they give you any kind of setup, like how to take care of the baby in the first few days and stuff?
That's a great question. So for most vaginal deliveries, you're in the hospital for about 48 hours after you give birth. And then if you have a C-section, you're usually there in the hospital for about 3 or 4 days just to make sure, everything is healing and recovering appropriately. So before you get discharged home, you'll certainly be able to talk to your pediatrician as well as the nurses in the hospital for any questions or, things to kind of look out for after you go home, and just make sure that you feel comfortable with the plan. So usually once the mom's doctor, the OB, clears mom home to be able to go home, we usually just make sure baby's ready to go home too.
Gotcha. And do we make a follow-up appointment with the doctor in a week, or do we have to wait for a month, or how does that work?
Yes, that's a great question too. And usually we do like to see babies back in our office within about 2 or 3 days of going home from the hospital.
Okay.
And that's important because we want to make sure that the feedings are going well. We want to assess for, any issues with losing too much weight or other common issues that can come up in the newborn period, like jaundice. And so we like to see babies shortly after they get discharged from the hospital. And then after that, we typically follow the recommended schedule for wellness checkups. So the next one after that would be at 2 weeks of age, then 4 weeks, then 2 month, 4 month, 6 month, 9 month, and 12 month.
Okay,
So
gotcha.
you don't have to remember any of
Anything.
this
They're gonna call
because
me,
your
they-
pediatrician is going to tell you all of this. But
That's
that's
nice.
just to give you an idea of how frequently we see babies in the first year. And it actually works out great because so much can change even within a few weeks to a few months of a infant's life that you're kind of ready for that next visit to
That's great.
to see, track how the growth is, track the developmental milestones. And so I always encourage expecting parents, hey, think about, who you want to follow up with as your pediatrician.
Okay.
A lot of times with our first babies, especially, we're so focused on how do we get through this pregnancy?
Yeah,
How do we get the
forget
baby
about
out?
the baby.
And then you kind of have to have a plan for
your
the baby
kids.
after the delivery too.
Gotcha. Now that you talked about jaundice, I've always heard that. And is that something scary? They do some kind of light therapy. Is that common? And can you
Yes.
tell us a little more about it, about the jaundice in newborn, Dr. Brandon?
Absolutely. That's a great question. And I'm so glad that we have an opportunity to discuss that because jaundice is a term we throw around a lot. And so
Yeah.
any parents of newborns will hear their nurses talk about it, they'll hear their doctors talk about it.
Yeah.
And what we really mean when we say jaundice is that yellow color to the skin or the whites of the eyes. Now, if an adult has jaundice, that's usually a bad thing. It
Yeah.
means maybe there's
Yeah.
a liver problem or some other medical
Yes.
issue. But in newborns, it's very common and even expected in the first week. So what actually causes jaundice, that yellowing to the skin or the eyes, is something called bilirubin. And bilirubin is something that we produce in our bodies, every day. So when we break down old red blood cells and form new red blood cells, a byproduct of that is bilirubin. And so this bilirubin typically gets filtered through your liver and through your gut, your intestines, and that's how we kind of filter through it. Now, newborns have a few things kind of going against them right from the beginning. They have more cells that are turning over, so they have even more bilirubin that their bodies are producing and having to filter through. And their little livers are still immature, so it has a hard time kind of keeping up with that excess bilirubin production. And then their guts, their digestive tracts are just waking up. During the pregnancy, mom's placenta has provided all the nutrition. And so now the digestive tract is having to kind of function and filter through all these things. And so that bilirubin that our bodies produce, it deposits in the skin. And when it does that, it causes that yellow color to the baby's skin or the whites of the baby's eyes. Now that in itself is not harmful. It sounds kind of scary, but eventually the baby's body will kind of catch up, and good feeding and hydration will help filter through all of that. But the reason we monitor it so closely is that if the bilirubin level keeps going up, then it can actually deposit not only in the skin, but in other organs. And
Okay.
so what we worry about is if that bilirubin starts to deposit in the brain, that can lead to long-term issues from hearing loss to brain damage down the line. So because it's something that is easy to assess for and treat, we want to make sure that we stay on top of it and stay ahead of it. So that's why most hospitals have screening protocols in place where they're going to be checking that level, and most pediatricians like to do that follow-up in their office within the first few days so they can assess and make sure that it doesn't need to be treated
Okay.
in any other way.
That's good to know. So
Yeah.
that makes me feel better. It's like, that's a scary term, jaundice and
It
herpes.
is, especially when you don't really understand
They're like,
what
"Oh
all
my
of
God,
that
what
means.
happened to this?" That's good.
Exactly.
And then the next common thing with the newborn is the sleeping pattern.
Yes.
You moms, they'll be asking, when will my baby sleep? They're waking up every 2 hours. Is there something that the new parents need to know or need to expect to know in the first few weeks, and how they can train their babies? I don't know.
Right. So new parents are not going to like this answer, but newborns are party animals at night, especially for the first 8 weeks or so.
Oh.
And, even a lot of moms, when they're pregnant, if you ask, hey, when is the baby most active? They'll tell you it's when I'm in bed trying to sleep, that baby starts kicking. And it kind of makes sense, when you're up and walking around during the day, that those movements kind of rock the baby to sleep. And then when you're ready to go to bed, all of a sudden they wake up. So that pattern actually continues for the first several weeks. And it's tough. It's really tough because when you're the most tired, that may be when the baby's most active. And so, one thing that helped me with when I had my kids was just keeping in mind that it's temporary. It does get better. They start to be able to sleep longer stretches after the first 6 to 8 weeks, and so it's kind of just getting through that first initial phase. Sometimes it does help to just keep the house a little bit more bright and noisy during the day, a little darker and quiet at night, and maybe make your post 2 p.m. time your maybe more active time, where you do your tummy time, or don't let the baby take too long of a nap in the afternoon, just so we can have the opportunity to kind of reset the cycle.
So sleeping. The next thing is feeding. Moms, how much do I feed? Am I feeding less? Am I feeding too much? Is there few guidelines that you can tell our listeners?
Yeah, absolutely. And I think it's tough in the beginning because we kind of have to follow the baby's cues, and they do feed pretty frequently in those first few weeks. So usually about every 2 to 3 hours for the first few weeks, the baby's ready to feed. And if you're planning on breastfeeding or doing a combination of breast and bottle feeding, it's important to let the baby feed frequently, because you want to send the right signals to your body so that you can ensure a good milk supply, good long-term breastfeeding success. So the goal is to have 8 to 12 breastfeeding sessions per day to establish good breastfeeding patterns long-term. And then if you're bottle feeding, the first couple of days the baby's not going to take a whole lot of volume, but that picks up to about 2 to 4 ounces per feeding every 2 to 3 hours in the first few weeks. So the first couple of days, because that digestive tract is still kind of starting to wake up, the stomach is the size of a marble, and so it doesn't take much to fill it up. And so that early colostrum that your body produces, if you're planning to breastfeed, that's great for this stage. And then in order to kind of keep up with the baby's increasing demands over the next several days, we just want to make sure that we feed pretty frequently. The more often that you feed at the breast, that sends the signal to your body, hey, baby is using all this milk that's being produced, so we need to make more. And so that's why it's really important to look for the hunger cues, follow the baby's hunger cues, and kind of do that on-demand feeding pattern. So we kind of let baby lead the way.
Gotcha. And you're talking about breastfeeding, so there are a lot of support system for the moms to know about it. And you said you have lactation consultants. So I think that's a very useful tool of information in your practice, as newborn moms have a lot of questions and they need lots of help. So would you talk a little bit about that?
Absolutely. And I think one of the most important keys to ensure successful breastfeeding is to utilize your resources. So, it's fantastic now that most hospitals are recognizing this too. So they're going to have a lactation consultant to support you from the very beginning. Nice. So especially if it's your first time, just ask for help right from the hospital. If something doesn't feel comfortable, have
Yes.
someone help you, because you don't want to get set on doing things that are not going to work long term
Long-term,
and
yeah.
be a setback. And so, even your nurses in the hospital, if you're not sure how to position the baby properly,
They
call
would
for
have,
them
yeah.
to help you. And then many pediatricians as well as OBs will also have a lactation consultant in their offices too. And that's been fantastic for some of my families, my patients. Sometimes your troubleshooting takes place after you've already gone home from the hospital. Maybe something doesn't feel
Always,
right.
yes.
Maybe you don't feel like the baby's,
Yeah.
gaining weight like
Weight,
they
yeah.
should. And so it's just really, really important to ask for help. I remember with both of my kids, I saw the lactation consultant probably every week for the first 6
Yeah.
weeks until I felt comfortable. And then for any specific questions, I did just want to mention our lactation consultants at our office have put together a breastfeeding library on our website on forestlanepediatrics.com. So
Nice.
if there are any specific topics, I'm sure there's some information on that. But really just using your support systems and making sure that right from the beginning you're sending the right signals to your body and doing those frequent feedings. If the baby's having trouble latching, talking to your lactation consultant about, hey, when should I start pumping and expressing breast milk, and just making sure that you just kind of seek out that help.
Gotcha. Okay. The next common thing, as I remember, is the gassy. The babies
Yes.
are gassy. They cry. The stomach. I remember that they cry. How do we take care of those things?
Yes, that's a great question. And I think one thing is important to just kind of step back and recognize that gas is not necessarily abnormal or even a bad thing. It's kind of part of the process. So when babies feed, regardless of whether they're drinking from a bottle or breastfeeding, they're going to gulp down air. That's just how they feed. So they're going to swallow air. And anytime they cry, they're going to swallow air. And what can be tricky is that newborns have very immature, uncoordinated muscles. So if you ever watch a newborn move when they're not swaddled, when they're just laying down, you kind of see their arms and legs moving in uncoordinated way. It's very cute.
Right.
And then if you imagine your muscles on the inside, like your digestive tract, which is basically a series of muscles, those muscles are very immature too. And so they contract in very uncoordinated ways. So sometimes that air that the baby has swallowed just kind of gets trapped. They have a hard time releasing it. And unlike adults, if we have to pass gas or pass a bowel movement, well, we can isolate our pelvic muscles and
Yeah.
clear it. But in newborns, they kind of strain with their whole bodies.
Yeah,
It's painful to
For
watch,
moms,
right?
when moms
For
get so
moms,
scared.
yes.
Yes.
And so, there are a lot of things that can help alleviate that. Although we know that it's a very normal process, we still want to help our babies feel as comfortable as possible. So one thing that's really helpful is positioning, particularly upright positioning. So after the baby feeds, try to hold them up on your chest if you can for 20 minutes or even a little bit longer. That's going to let all the air bubbles kind of settle down a little bit, help minimize the spitting up. Pacing the feedings, taking little breaks during the feedings, that helps. If baby seems gassy or you're having a hard time getting a good burp out, you can lay them down on their side or their tummy just for 30 seconds to a minute, then kind of pick baby back up. Sometimes that gets the air moving and helps them out. You can kind of push their legs in and out a little bit, massage the tummy. All of that can help. And then you can also talk to baby's doctor about whether there are medications that could help with gassiness. So there are over-the-counter gas drops that can be helpful in some babies. And then there have also been more recent studies on the use of probiotic supplements to help with digestive discomfort in babies too. So that's always something you can discuss with your child's pediatrician and say, hey, we've tried all these things. Would there be any other medications that might be helpful?
Gotcha. And in the first few weeks or months, are there any immunizations or anything, Dr. Mandarin, that the kids have? I mean, the newborn has to get it and stuff?
Yes, and actually, the first immunization is usually administered in the hospital, the
Okay.
hepatitis B vaccine,
Okay.
which they'll go over and give you, the information and the consent form to sign in the hospital. There are also several screening tests that babies will get done in the first few weeks, and some of these happen right in the hospital. So, usually you'll get a hearing screen done in the hospital before you go home. And I do like to mention on the hearing screen, sometimes it's hard to get an accurate result or an accurate test in the first few days because there can be a little fluid from the delivery in the ear canal, and so if it takes a couple of tries, that's okay. But most babies do get a hearing test done. There's also a blood test called the newborn screen that gets done
Okay.
at the 24-hour mark, and then again, usually at around the 2-week mark. And the newborn screen is about it's a blood test that checks for 30 different things.
Okay.
So it's a great screening tool.
That's good. So
Yeah.
they kind of look at things that can happen
Yes,
wrong.
like
and-
metabolic disorders,
Okay.
cystic fibrosis, thyroid disorders.
Okay,
So
that's
yeah,
nice.
that gets sent off to the state, and then usually those results get processed and resulted back to the pediatrician within about 2 weeks. So generally, no news is good news, because if something alerts us that further testing needs to be done, they kind of contact your pediatrician and let the parents know right away.
Dr. Manning, thank you so much. You kind of talked to us about the most common things that
Yes.
all the new parents have: sleep pattern, eating pattern, when do I get, and good to know that there is support system available, a lot of resources
Yes.
available, and the pediatrician's office, they have a lactation consultant. That's always good to know. It's very reassuring. I think for the first time parents, having a good pediatrician like you and explaining things is going to make a big difference. Oh God, even when I was a first time mom, I was freaked out. What do I do? Do I call my pediatrician? I think it's very important that you have all the resources and stuff. And thank you so much for giving us all the information, the essence gist and stuff. Any last minute info to the first time parents, what they need to know, and your website, resources from your practice that they can log in and find out, please share it with us.
Absolutely. And thank you again for having me. It's just really fun for me to get to talk to families, and especially new parents. Yes, so, a lot of what I've talked about, as well as some additional resources, are on our website, forestlanepediatrics.com.
Okay.
There's actually a section called New Baby, and
Very
it
nice.
has a link to our breastfeeding library. It has a link to kind of what to expect in more detail in the first few days, as well as some tips on comforting and soothing the baby. And then, as far as just kind of communication and accessibility, it's always good for parents to make sure that, there's a good way to reach their pediatrician. So it's always good to find out, how do we ask our questions? Do we call? Can we email?
Yeah.
Find out what their after hours availability is. So, I hope that this information is helpful, and I hope the resources on our website are helpful, and I'm always happy to answer any additional questions that come up.
Thank you, Dr. Manning. Listeners, you can listen to this podcast and our future podcast on Spotify, iTunes, and also you can watch our program, Facebook Live, and YouTube channels. We have a lot of useful information and wonderful. Like today evening was great to know about the newborn survival guide, and Dr. Manning was excellent, just talking to us about the common things which all moms have. Great piece of information. Thank you so much, Dr. Manning, for your time, and stay healthy, dear.